Hello everyone, my name is Dalia El-Bokle. I'm an orthodontist from Cairo, Egypt. Today, I'd like to show you how I use the new Medit Ortho Simulation software in my office. First, we scan the patient's upper and lower arches, face and occlusion using the Medit i500. Once the scans are processed, I press the simulation icon and I follow the instructions on the screen. Then I align the upper, lower midlines and press confirm. Next, I adjust the tooth segmentation and press confirm. Within seconds, the software generates a simulated treatment model and shows it side by side to the original malocclusion. So here it is a case with spacing and a deep overbite, and its predicted outcome. You can also select the simulation preview to show a morph of the expected change. You can also manipulate the models to see a frontal or a side view of the morph, as well as upper and lower occlusal view. Here is another case with blocked-in upper lateral incisors and the intended treatment outcome. I like to show this simulation to the patient on the same day that we are taking the records. Sometimes we use the tooth moving feature. It can derotate, bodily move, tip or torque the teeth in order to refine the tooth positions. Patients think it's really amazing and they love the fact that our office is using the latest technology. The software can generate several treatment scenarios, as you can see here. This facilitates decision-making in tough cases, such as cuspid substitutions or non-conventional extraction cases, as this one, for example. So here, I'm removing upper bicuspids and the lower incisor. The software allows me to compare the resulting overjet, molar, and canine relationship with such a treatment plan. This takes the guesswork out and is less time-consuming than doing digital setups using third-party software. We also use the occlusion curve feature to visualize the amount of extrusion or intrusion needed in order to achieve a consonant smile arc. This tells me exactly where to position the brackets vertically from canine to canine. And here I'm using the tooth moving feature again in order to achieve such extrusion. We can also use the software to predict the need for arch expansion and any torquing movements required in order to coordinate the upper and lower arches after initial alignment. The simulated result of the teeth can also be aligned with the face scan to show the future smile, both from the frontal and the profile views. For example, here we can see the effect of space closure on the patient's smile, as well as the effect of anterior retraction on the smiling profile. The last step is showing all this to the patient. Rather than using handheld models to explain, the digital simulations make my consults easier and more effective. The patient is better informed and can be positively involved in decision-making. Using the simulation software, virtual consults can be as effective as office consults, with the patient comfortably watching my computer screen from home, along with family members. This is an added advantage during the present time of the COVID-19 epidemic, as I don't have to talk for 10-20 minutes wearing an N95 mask. I'm sure that all of you can relate to that. A screenshot of the simulated treatment outcome or a side-to-side comparison is then shared with the patient by email with a disclaimer stating that this is only a simulation and not a guarantee of the orthodontic treatment result. If a picture is worth 1,000 words, this 3D simulation is worth 1,000,000 and is definitely an asset to my practice, not only for patient engagement, but also for practice promotion. Thank you, everyone, and please stay safe.